Did you know that the way you sleep tonight could quietly push your heart toward danger without a single warning sign? What I'm about to reveal may seem unbelievable, yet it affects millions of older adults across America every single night. I'm Dr. Thomas, a cardiac surgeon with more than 2 decades caring for seniors whose hearts have carried them through a lifetime. Again and again, I've watched strong, independent people walk into my clinic with heart problems not caused by disease alone, but by something far more subtle: the very position they sleep in. These aren't dramatic accidents or rare medical conditions. I'm talking about the ordinary habits you follow every night, the posture you settle into without thinking, the angle of your head, the curve of your back, the way your chest expands or compresses as you breathe. What seems harmless, even comforting, can slowly weaken your heart, strain your circulation, and steal the rest your heart desperately needs as you age. Stay with me. By the end of this video, you'll understand which sleeping positions may be damaging your heart, why older adults are especially vulnerable, and what simple changes can protect your heart starting tonight. Before we dive in, if you haven't subscribed yet, I recommend you hit that button and turn on the bell so you never miss another health tip made just for you. If you enjoy this video, type 1 in the comments. If not, type 0 to let me know how I can make better content for you. Sleeping position number 1. Sleeping on your back with your head positioned too low. When you reach your 60s, 70s, or 80s, something as ordinary as the way you rest your head at night can quietly shift from harmless routine to a hidden threat. Many older adults in America prefer sleeping on their backs, believing it keeps the spine straight and reduces joint pressure. But when the head lies too low, when the pillow sinks or the upper body is not elevated enough, your airway narrows, your chest tightens slightly, and the oxygen your heart depends on becomes just a little harder to draw in. That little difficulty may seem innocent, yet in an aging body, the smallest disruptions often carry the greatest cost. As we grow older, the tissues in our throat relax more than they once did. Gravity pulls them downward during sleep, especially when the head is low. This makes breathing less efficient, forcing your heart to compensate. It must beat harder to move oxygen through your blood, even though your lungs are quietly struggling in the background. Many seniors describe waking up tired despite a full night's sleep, not realizing their heart spent the entire night working overtime. What appears to be a peaceful sleeping position can slowly drain the strength of a heart that has already carried decades of responsibility. For people with sleep apnea, a condition far more common after age 60, this position becomes even more dangerous. The airway collapses more easily, creating repeated drops in oxygen throughout the night. Each drop is like a shock wave through the cardiovascular system. Blood pressure surges. Heart rhythm becomes unstable. In some cases, doctors can even see the stress on the heart muscle during morning examinations. Over time, these nightly strain cycles can weaken the heart, contribute to heart failure progression, and increase the risk of arrhythmias. It is an invisible battle happening while you sleep, a quiet assault that can damage your heart without causing immediate pain or warning. And for seniors with a history of high blood pressure, coronary artery disease, or congestive heart failure, sleeping flat on the back with the head too low is especially risky. Fluid shifts toward the chest during the night, making breathing heavier and forcing the heart to pump against resistance. That weight on the chest, barely noticeable to the sleeper, can gradually destroy the heart's ability to rest. A heart that never rests is a heart that eventually breaks. Yet many older adults continue sleeping this way simply because no one ever told them the truth. They assume exhaustion is part of aging, when in reality, their sleeping position may be silently undermining their health. Raising the head of the bed 6 to 8 inches, or using a supportive wedge pillow designed for seniors, can relieve nighttime pressure on the airway, protect oxygen flow, and finally allow the heart to relax. For many, this small change becomes the difference between fatigue and vitality, between strain and true rest. But if this simple position can quietly harm your heart, what about the posture that shifts blood flow in an even more dramatic way? One that many seniors believe is completely harmless. The answer may surprise you. If you're still watching and finding these insights helpful, please comment number 1 below to let me know you're with me. Now let's move on to point number 2. Sleeping position number 2. Sleeping on your right side for long periods. There is a quiet belief among many older adults that sleeping on the right side is harmless, perhaps even comfortable, especially when the body feels stiff after a long day. Yet, what feels familiar and soothing may be working against the heart in ways most people never notice until the damage has already begun. As the years pass, the heart loses a bit of its youthful resilience. It becomes more sensitive to pressure, fluid shifts, and changes in circulation. And when you lie on your right side for long stretches of the night, your body undergoes subtle internal changes that can place unexpected strain on a heart already doing its best to keep you alive. When an older adult sleeps on the right side, gravity changes the return of blood to the heart. In younger years, the cardiovascular system adapts easily, but after 60, the heart muscle may be stiffer, the valves may not open as smoothly, and the veins may carry extra fluid that the heart must constantly manage. Lying this way can increase the workload on the right chambers of the heart, the very chambers responsible for collecting blood from the body. Instead of resting, your heart is pushed into a state of quiet overexertion. For someone living with mild heart failure, valve disease, or chronic swelling in the legs, this position can create a surge of nighttime stress that accelerates fatigue and slowly erodes heart strength over time. Many seniors describe waking up with a heavy chest or feeling unusually breathless during the night. What they don't realize is that sleeping on the right side can subtly shift abdominal organs toward the heart, adding external pressure at a time when the heart should be resting. This gentle but persistent compression may restrict cardiac filling, forcing the heart to pump faster and harder. Over months or years, this extra strain can begin damaging your heart, weakening its ability to function efficiently. For someone whose heart already fights against high blood pressure or reduced elasticity, the long-term effect can be deeply harmful, an invisible force slowly working to destroy your heart's nighttime recovery. Even more troubling, research has shown that people with certain cardiac conditions naturally avoid the right side during sleep without consciously knowing why. Their bodies sense the discomfort their minds ignore. Yet those who continue sleeping this way may unknowingly worsen palpitations, nighttime arrhythmias, or fluid congestion. What feels like a comfortable habit may actually be a signal that the heart is struggling. Fortunately, small adjustments such as shifting to the left side, using a supportive body pillow, or elevating the upper torso can reduce pressure on the heart and allow it to rest more fully throughout the night. Protecting your heart does not always require drastic change. Sometimes it begins with a simple shift in how you lie down to sleep. But if sleeping on the right side can quietly strain your heart, Imagine what happens with a position that compresses your chest, restricts breathing, and challenges your heart with every single breath. That danger is far more common than most older adults realize. Sleeping position number 3, sleeping on your stomach. For many older adults, sleeping on the stomach is a habit formed decades ago, one that once felt comforting, safe, or simply familiar. But as the body ages, this seemingly harmless posture transforms into something far more dangerous, placing silent pressure on the heart and lungs at the very stage of life when they are most vulnerable. What once supported deep, effortless sleep may now be slowly damaging your heart night after night without you ever realizing the danger. When a senior lies on their stomach, the weight of the upper body presses down against the rib cage. The chest cannot expand fully, and the diaphragm, your most important breathing muscle, cannot move as freely as it needs to. This restriction reduces lung capacity, lowering the oxygen levels your heart depends on to function. Your heart, already working harder due to age-related stiffness, is suddenly forced to pump more vigorously just to maintain enough oxygen in your bloodstream. Over long periods, this constant strain can begin to destroy your heart's ability to rest and recover while you sleep. In younger years, the heart can tolerate this type of pressure, but for someone over 60, especially those living with hypertension, coronary artery disease, atrial fibrillation, or mild heart failure, stomach sleeping becomes a dangerous burden. The reduced airflow can trigger subtle dips in oxygen saturation that you never notice, but your heart does. Each dip forces it into overdrive, beating harder, faster, and with greater stress. These nightly episodes of oxygen deprivation may contribute to morning fatigue, dizziness, or that unsettling feeling that something isn't right deep inside your chest. Seniors often blame these symptoms on age, not realizing their sleeping position may be setting the stage for long-term cardiovascular damage. Even more concerning is the way stomach sleeping positions the neck. The head must turn sharply to one side, compressing arteries that carry blood to the brain and straining the nerves that help regulate heartbeat. This unnatural twist can disrupt normal circulation and trigger irregular heart rhythms during sleep. Many older adults wake with pounding hearts or sudden jolts of breathlessness, never connecting the experience to the posture they maintained for hours. Over time, this combination of restricted breathing, poor circulation, and increased heart strain forms a quiet assault, one capable of damaging your heart in ways that accumulate gradually but dangerously. And then there is the emotional weight this position carries. Imagine your heart, an organ that has served you faithfully through a lifetime of challenges, struggling each night beneath the pressure of your own body. Imagine it working harder than it should, pushing against resistance it cannot escape, fighting through hours meant for healing. This hidden strain is not dramatic or sudden, but it is real. And for many older adults, it is the beginning of a slow unraveling that could have been prevented with a simple change. Shifting away from stomach sleeping can open your chest, improve oxygen flow, and ease the burden on a heart that deserves protection, not pressure. And yet, as concerning as this position is, it still does not compare to a posture many seniors rely on daily, one that appears supportive but can quietly sabotage circulation in a way few people suspect. If you're still watching and finding these insights valuable, please comment number 1 below to let me know you're here. Now let's keep going with point number 4. Sleeping position number 4, sleeping upright or half-seated in a recliner. Across the United States, countless older adults have unknowingly turned their favorite recliner into their nightly bed. It begins innocently. Perhaps breathing feels a little easier when sitting up, or lying flat seems uncomfortable, or the heart feels steadier when elevated. Over time, the recliner becomes a place of comfort, a place of safety. But what feels safe is not always harmless. And for many seniors, night after night in a half-seated position is slowly damaging the heart in ways far more serious than they imagine. When you sleep in a recliner, your body settles into a posture where the hips remain flexed, the abdomen compresses inward, and the legs hang just low enough to allow fluid to pool. During the day, your heart already struggles against gravity to return blood from your legs back to your chest. But sleeping in a recliner forces it to fight that battle all night long. Instead of resting, your heart works overtime, pushing against resistance created by swelling, poor venous return, and restricted circulation. This constant strain may gradually destroy your heart's ability to recover, especially in adults living with high blood pressure, congestive heart failure, or chronic edema. Many older Americans who sleep in recliners describe waking with heavy, swollen feet, a pounding chest, or a sense that their heart never settled down during the night. What they do not see is the internal struggle happening quietly beneath their ribs. The partially seated angle compresses the diaphragm, the muscle that drives breathing. When the diaphragm cannot move freely, the lungs cannot fully expand. Oxygen drops. The heart panics. It beats faster and harder, trying desperately to compensate. For a heart already aging, perhaps enlarged, stiffened, or weakened by decades of life, this nightly stress can accelerate decline and slowly damage the heart structure. Even worse, this position can subtly reduce blood flow to the coronary arteries, the vessels that feed the heart muscle itself. When the torso is bent forward even slightly, abdominal pressure increases. This pressure can reduce the efficiency of the heart's circulation at the very moment it needs the most oxygen. Over years, these repeated episodes may contribute to worsening heart fatigue and nighttime episodes of breathlessness that many seniors mistake for just getting older. And yet, the recliner feels comforting. It feels supportive. It feels like a solution. But beneath that sense of comfort lies a dangerous illusion. Your heart cannot rest when your body is trapped in a posture that quietly restricts airflow, disrupts circulation, and steals the recovery your heart depends on to survive. You may think you're helping your heart breathe easier, when in reality, you may be placing it under a relentless strain that slowly destroys its strength. Transitioning back to a proper bed, using adjustable support, or elevating the upper body safely can give your heart the relief it desperately needs. But before you feel too secure in this adjustment, there is still one sleeping position more deceptive and potentially more harmful than all the rest. It's the posture many seniors find cozy, familiar, and comforting, without realizing the hidden danger it carries deep within the chest. Sleeping position number 5. Sleeping in a tight, curled, or fetal position. For so many older adults in America, curling up into a tight, protective ball at night is more than a sleeping habit. It is a memory of comfort. It is how they slept as children, how they rested through difficult winters, how they soothed aching joints when the world felt overwhelming. Yet, as the years pass, What once provided emotional warmth begins to place unexpected pressure on a body that no longer moves or breathes the way it used to. The fetal position, so familiar and reassuring, can slowly become one of the most dangerous positions for the aging heart. When the body folds forward and the knees are pulled toward the chest, the space within the rib cage narrows. The lungs cannot fully expand. The diaphragm, which should glide downward to draw air in, becomes trapped, pushing against a compressed abdomen. This subtle but powerful restriction causes shallow breathing, sips of air instead of full breaths. And while younger lungs may tolerate this, an older heart cannot. Each shallow breath delivers less oxygen. And with less oxygen, the heart must beat harder, faster, and under increasing strain. What feels like a peaceful curl of the body may be quietly damaging your heart, forcing it to work overtime throughout the night. For seniors living with hypertension, atrial fibrillation, coronary artery disease, or early stages of heart failure, this extra burden becomes even more dangerous. When the chest cavity tightens, the heart has less space to fill properly. It cannot expand fully with each beat. Imagine a pump being squeezed as it tries to draw in water, restricted, overworked, and forced into dysfunction. Over months or years, this nightly compression can weaken the heart muscle, reduce its efficiency, and slowly destroy your heart's ability to recover during sleep. Many older adults wake feeling exhausted, dizzy, or strangely unsettled, unaware that their sleeping posture may be creating the very symptoms they fear. This curled position also affects circulation. When the knees are drawn to the chest and the spine curves sharply, blood flow through the large vessels in the abdomen can be reduced. This leads to pooling in the legs, swelling in the ankles, and increased pressure on the veins. The heart then struggles to return that pooled blood back to the chest. Instead of resting, it is pushed into a nightly battle against resistance created by the body's own posture. The long term effect is subtle but real. A gradual weakening of cardiovascular resilience, often mistaken for just aging. Emotion adds another layer. Many seniors curl into themselves at night because it feels safe in a world that has grown louder, faster, and more complicated. They do not realize that the very posture meant to protect them is silently stealing the oxygen their heart needs and compressing the chest that once breathed freely. The body may find comfort in the position, but the heart does not. It labors through the night, unseen and unheard, straining against the very shape of the body it keeps alive. Gentle adjustments, stretching the torso, aligning the spine, using supportive pillows, can ease this hidden pressure and allow the heart to breathe again. But before you assume these 5 positions are the whole story, there is one final truth every older adult must hear. The most dangerous part of nighttime heart strain isn't only how you sleep, it's what these choices reveal about the silent risks unfolding inside your body as you age. Your heart has worked a lifetime. Now it needs you to work for it. As we bring these truths together, one message rises above all the rest. The way you sleep, something you have done every night of your life, may now carry consequences your younger self never had to fear. With age, the heart becomes less forgiving. It no longer rebounds from strain as easily. It no longer hides its discomfort as quietly. And while none of these sleeping positions alone can destroy your heart overnight, the slow, steady pressure they create can add up to years of unnecessary stress on an organ that has already served you faithfully through a lifetime of memories, challenges, and triumphs. For many older adults across America, heart damage does not come from dramatic events. It comes from the overlooked, repeated habits that chip away at strength gradually. Habits like restricted breathing, poor circulation during sleep, chest compression, or nighttime elevations in blood pressure. These are not imaginary dangers. They are real physiological burdens documented in countless clinical observations of seniors who arrive at their doctor's office exhausted, breathless, or frightened, never realizing that their heart has been fighting a nightly battle just to keep up. But here's the part most people never hear: you are not powerless. You can reshape your sleeping environment, adjust your posture, and choose positions that let your heart rest instead of strain. Small changes: lifting your head, opening your chest, uncurling your legs, returning to a proper bed can relieve years of silent pressure within weeks. Your heart is not seeking perfection. It is simply asking for space, oxygen, and the freedom to recover. And the truth is, you deserve that rest just as much as your heart does. After a lifetime of working, caring, surviving, and giving, this is your time to protect the body that has carried you through it all. But before you make these changes, there is still one final understanding every senior must hear, because protecting your heart at night is only half the story. What you do during the day may be placing an even greater burden on your heart than you realize. Would you like me to continue? These lessons are meant to inspire you to live fully and authentically. Now, I'd love to hear from you. Take a moment to reflect and share one thing you've learned and plan to apply in your own life. Let's support each other on this journey toward embracing these truths. If you enjoyed this video, please leave a comment with 1. If not, feel free to comment with 0. Your feedback means a lot to us. Don't forget to like, share, and subscribe to our YouTube channel for more content like this. Thank you for watching, and here's to living life on your own terms.